everyone, today I'm going to demonstrate how to administer the 8 medications that go along with the medication administration training. Our first medication that I'm going to demonstrate are the simethicone chewable tablets. So the first thing I need to do is wash my hands, and I am just using a 60% alcohol-based hand rub, but the best practice would be to use soap and water at a hand washing station. Okay, I'm going to gather my supplies. So for the chewable tablets, all you need is your medication, your medication cup. We'll use gloves, the monthly medication record, and a pen or pencil to document that you've administered the medication. So the first thing that we're going to do is our first medication check. So I'm going to compare the medication container with the monthly medication record and the parent authorization form. So we have for Joey Doe, simethicone chewable tablets. They're 40 milligram tablets, and he is to chew 1 tablet after each meal. So you can see simethicone chewable tablets. They're 40 milligram tabs, 1 tablet after each meal for Joey Doe. And on the parent authorization form, we have that Jane Doe signed that Joey Doe can have 1 40 milligram tablet of simethicone chewable tablets for gastric upset by mouth after each meal. So then we're going to do our second medication check, and we want to check the expiration date. So this medication is not expired, and we're going to see if there's any special instructions. So it's just to chew 1 tablet after each meal. We have our second medication check, and it is a simethicone chewable 40 milligram tablet. Joey Doe is to take 1 tablet after each meal. We're going to double check against our monthly medication record. We have the simethicone 40 milligram chewable tablets. Joey is to chew 1 after each meal. And we have that Jane Doe authorized for us to give Joey Doe 1 40 milligram chewable simethicone tablet after each meal. And we just want to be aware any possible side effects from this medication could be abdominal pain, and he is taking this for gastric upset. Okay, so we're going to open our medication container, and without touching the inside of the medication container or the inside of the lid or the medication, I'm going to dispense 1 chewable tablet into the lid of the medication container, and I'm going to place that dose into the medication cup. I'm going to replace the lid on the medication container. I'm going to take the medication and supplies to Joey so that I can discuss the procedure with him. So Joey, we're going to have you take 1 chewable tablet. You can put it in your mouth, chew your tablet, and then we'll give you a drink of water. So once you bring the medication to the child, you're going to do your third and final medication check. So we have for Joey Doe 1 40 milligram chewable simethicone tablet for him to take after each meal. I'm going to check again against my monthly medication record. So we have a simethicone chewable 40 milligram tablet, 1 after each meal for Joey Doe, and we have that Jane Doe has authorized for us to give him that medication. So I am going to put my gloves on. And we are going to have Joey put the medication in his mouth and chew it. We're going to allow him time to swallow the medication and give him a drink of water. And we're going to ensure that he swallows the entire dose of medication. Once we've ensured that he has swallowed the entire dose, we can remove our gloves. We'll wash our hands. and I'm going to document that we administered the medication to Joey. And I administered the noon dose, so I signed my initials right there. And now I can return the medication to the proper storage area. So I'm going to return it to my locked medication box. And I am going to clean my medication preparation area. We'll throw away our gloves, clean our preparation area, and then we can return any unused equipment, which I don't have any, to the medication storage area. And we are going to observe Joey for any adverse reactions like abdominal pain.